are going to identify some of the superficial muscles on the head, neck, the chest, and the abdomen, front and the back. So first, let's look at the easy ones. The good thing about muscles is if you know your bones and the body parts, you can easily relate the name to the bone or some part, or we know how we name the muscles, right, based on the shape, whether it's triangular or trapezium-like, or whether it's doing a flexion or extension. So we have some criteria for naming muscles. So let's start. What do we have here? What bone do we have here on the skull? So we call this muscle frontalis, okay? And then if you turn around, again, based on the bone on the skull, temporalis. And at the back, the occipital region, occipitalis, okay? And when we come back to the facial muscles, around the eye, you have a circular muscle. Whenever you say orbit, it's something round and circular. So we call this orbicularis oculi. Oculi, ocular region is around the eye, right? Then you have your orbicularis oris, okay, around the mouth. Then what bone do we have here? Zygomatic bone. So there are two muscles. One is longer than the other one. On the side, you can see they're coming from the zygomatic bone, connecting to the corner of your mouth, behind the lips. This connects here to the upper lip, and this goes to the corner of the mouth. So the larger one, or the longer one, is your zygomaticus major. The shorter one, or the smaller one, is your zygomaticus minor. Then behind the mouth, what do we call this region? Buccal region. So this is your buccinator or buccinator, depending on how they say it. And behind that, there is a muscle that goes from the temple bone all the way to your mandible. This muscle, what do you call that? Masseter. Because masseter, mastication refers to chewing, so masseter helps with chewing. It moves your mandible. So some of these muscles are pretty easy when you learn the origin insertion, because if you know where they are located, for example, if you take orbicularis oculi, it's touching which bones? It's touching your frontal bone and the maxilla here. So it's going around, it's touching both the bones, and it inserts into your eyelids. If you take the orbicularis oculi, orbicularis oris, it's inserting into your lips, but it's touching which two bones here? Maxilla and mandible, right? So if you take zygomaticus muscles, they start from the zygomatic bone. The origin insertion will be behind the lips, depending on whether it's major or minor. So you need to go through the table to understand the origin insertion. So when you do that, if you can relate where the muscles are found, and always learn the name of the muscle, the action first, what it is doing, then you know where it has to insert. Because if some muscle has to move the lips, it has to insert into the lips. If it has to move the eyelids, it has to insert into the eyelids, and so on. Then you can try to understand the origin. So the most difficult part is the origin. Okay? And coming down to the neck, if you can see here, there's a muscle that goes from the sternum to the mastoid process, because you're not moving the sternum, it's not movable, right? So this should be the origin. The insertion is your mastoid process. So they call this muscle sternocleidomastoid. So you have one on the left, one on the right. If you're flexing your neck this way, you're using the left, right? You're using the right muscle. If you're doing this, you're flexing your neck, bending like this, you're using both, right? So that's your sternocleidomastoid. And then if you see in the front, what do you call this region? Yeah, if you are specific, pectoral, right? Refers to the chest. So this is your pectoralis muscle. They call it pectoralis major because there is a pectoralis minor inside. I'll show you that later. So you can even remove the pectoralis major. Okay. So now you can see the pectoralis minor. These are intercostal muscles between the ribs. And then if you see on the side of your thoracic region, like this, on both sides, you have this serrated margin. Right? It looks like an edge of a leaf or a saw. So they call this serratus anterior. Serratus anterior. The same thing wraps around to the back. They call it serratus posterior. And then, if you see the abdominal region, you see a bunch of abdominal muscles. Only one is very obvious. This is your rectus abdominis. That's where you have your 6 packs or 8 packs. I don't know how many you have. Okay, this is your rectus abdominis. These fibers are straight and they are parallel to the midline of the body. Then if you peel it off, if you see in your book, if you turn to another page where you can see the details, figure 8 on page 151, you can see the 3 layers. You can see the rectus abdominis, and then if you peel it off, inside you cannot see in this model, you have muscle fibers running like this, horizontal to the midline. They call it transverse abdominis. That's a deeper muscle, deeper to that. And then if you go a little bit lower here, on the side, you can see the fibers are going diagonal. This is your external abdominal oblique. There is one more layer inside, they call it internal abdominal oblique. So 4 abdominal muscles, rectus abdominis, your transverse abdominis is below that, and then you have the oblique, external abdominal oblique, and the internal abdominal oblique. So now I'm going to remove this so you can see that better. So if I turn it around, you can see the internal, you can see 2 layers, the external oblique, external abdominal oblique, and the internal abdominal oblique. That's below that. And this major muscle, you see the big one that separates the 2 cavities, your thoracic and abdominal cavity, that helps your breathing process. What is that? The diaphragm. So this is your diaphragm, and those are your pectoralis minor, and then you have the intercostal muscles between the ribs. So these intercostals and the diaphragm, they help you to breathe. Then let's turn the torso around on the back. You can see in the corner of your shoulder, it's your deltoid muscle. Deltoid, delta is triangular in shape. If you have flown Delta, you have the logo for Delta Airlines, right? Triangular, that's deltoid. And this muscle here, this is your trapezius. Okay, this is not complete in this model. You'll see it will cover this whole area, trapezius. Then in the corner of your armpit, you have 2 muscles right here. One is called the teres major, the big one, and the small one is called the teres minor. And this muscle, the big flap of muscle here in the lower back, the name is latissimus dorsi. It's in the dorsal region, so they call it latissimus dorsi. Then we have to look at the muscles of the arm and the leg individually, so we'll do that in